Hello, good evening. Welcome, everyone. I am very excited about our Instagram Live tonight, as I have the pleasure of speaking with Dr. Olga Zaytseff, who is the clinical director, and she is also the founder of O.L.G.A Fertility Clinic, obstetrician, gynecologist, and leading fertility specialist. And we're going to be talking about IVF money guarantee programs for you to have questions answered about why, what, how, what does this mean? And it's something that I looked into when I was having treatment and something that everyone asks us questions about. So I'm going to see if she's here today and we can get ready to get started. Welcome to those who are joining. Nice to see you today. Just waiting for Dr. Olga to arrive and then we can start. And if you have any questions, and we will make sure that we get them answered for you. Thank you for your patience as she's just joining. So some of the themes of today's live will include IVF refund, IVF money back guarantee programs. So, for example, explaining about why, the benefits from them, and the success rates from IVF treatments, and what to expect if you are pursuing this guarantee program. So I'm just going to see if she's here now. Thank you for your patience whilst Dr. Olga joins. And please do. Oh, I've seen someone's already asked a question. We will definitely answer that. I'm just waiting for Dr. Olga to join me, and then we can get started. Hi to those who are joining. Nice to see you today. Here we are. Hello, good evening, Dr. Olga.
Hi, Lois, and hi.
How are
Nice to
you?
see you. Very
You
good.
too. Thank you.
Delighted to be with you in this live.
Absolutely. I was just introducing you and the topic we are speaking about today. So please do go ahead and introduce yourself and Olga Fertility Clinic, and then we can get started with some great questions that have come in live and also ones that we have discussed to speak about today around IVF money back guarantee programs. So please do start off by introducing yourself.
Thank you very much for this opportunity. I am very much devoted to fertility since I was in my last years of university. So I applied by a German public organization, DAD, to get scholarship to go to Germany for postgraduate studies in the area of reproductive medicine, and was gladly accepted. It was a great opportunity. So in 2003, 2004, after having completed St. Petersburg State University, I went to Germany to get more study on IVF, and that's how it started. I was offered a contract to continue working in German university as a doctor. But at that time, I met my future husband who wanted to go back to St. Petersburg. So we went back to St. Petersburg, and there I worked for more than 15 years for Russian-Finnish clinic, Ava Peter, which is still existing.
Mhm.
And at that time already, we specialized in reproductive medical tourism, helping single women and couples from all over the world to achieve successful pregnancy after they haven't succeeded in their local countries. And the fact that we have been situated in Russia made us be as good as possible, because they came to us after having had 3 for public IVF, then 3 for private IVF in local country, and then maybe private IVF or egg donation in Spain or Czech Republic or somewhere else. So basically, since 2006, I was getting the lost single women and couples who were not helped in other clinics in Europe to achieve for them their long desired pregnancy and live birth. And the project started with egg donation because this was the solution for women in late 40s. That was the average age of patients I was getting. It's just that with the time, already like around 2010, 2012, 14, I started seeing among those potential donor egg recipients who were slowly getting younger, those who could have been helped with their own eggs. And then I was offering them, look, I mean, of course, we can find you a brilliant donor. Of course, we can solve this situation with donor eggs. But I mean, you are 41. The opportunity is this and that. You haven't tried this and that. So I see the chance to help you. And then women were looking at me as if I were crazy, because after, let's say, 10 times eggs out and double number of embryo transfers, I mean, they could not believe me that there is something to do. But at that time, we were already so strong in individualized IVF that there were options. And that's what brought me in 2016 to start money back guarantee, because that was the only way to say, come on, I mean, I share risk with you. I know what I'm doing, and yes, I can be wrong, or I can be over optimistic, but then I lose my money. You are not losing yours.
Yeah.
And that's how it started. And now we are in 2024. We have opened 900 something. I think we already by 1,000 of money back packages,
Wow.
own egg, donor egg combination. We have packages like 3-time IVF or 3-time egg donation IVF or 2-time IVF plus 2-time egg donation IVF. And 600 something have got children, 100 something are in treatment.
Amazing.
And refunds, I mean, in all these, what is it, 8 years? So we have at the moment 47 patients who got refunds.
It's not many out of that, is it?
It's less than 5%,
Yeah, it's
actually.
amazing.
Yeah.
Before we talk about this, because I have lots of questions to ask you, and I know people will have questions live, and someone has just mentioned how hard it is, and they've spent 30,000 USD on treatment, which is not uncommon. First of all, could you tell us a bit about Olga Fertility Clinic? Because you have a clinic in Cyprus as well. Please, could you tell us a little bit about where you're based and who comes to see you?
Yeah. So to logically move from the story of working in Ava Clinic in St. Petersburg. So then in 2019, I opened my own clinic in collaboration with a brilliant surgeon, Dr. Lapina, in Russia, in St. Petersburg. So we opened a clinic which is 1,000 square meters, beautifully renovated old building from 19th century in the heart of St. Petersburg. And we worked very successfully until pandemic started in 2020. Still, we didn't give up. So after 4 months of complete lockdown, we launched our own charter planes to bring patients from
Wow.
Scandinavian countries to St. Petersburg. And it is like in Arlanda Airport, it was mysterious terminal number 69, the gate number 69, which every Sunday a mysterious plane was coming to pick couples and single women to bring them to St. Petersburg, and then next Sunday back. So
Wow.
in the end, the number of our international babies born after embryo transfers in 2020 were very similar to
Yeah.
other years.
That's amazing that
So
you were able to continue treatment like that and help change so many people's lives.
that is very important, because our patients are in their late 30s or early 40s, those who plan IVF with their own
Yeah.
eggs. So, I mean, for them, if they were preparing for egg pickup, waiting extra half a year, that's a drama.
Yeah.
So we were pushing all the buttons with all the ministries, and we pushed this through to help people. So, but then, as you know, a huge tragedy started in 2022. And I can understand that many couples and single women did not want to travel to Russia anymore. The situation was so that women wanted to travel because they knew how strong we are and how many friends of them we have helped. But husbands and brothers and fathers, they were talking them out. And then our patients wrote us a long letter, like our patient community is very strong in Scandinavian countries. And they wrote me a letter with many, many signatures asking, can you continue helping us, but can you consider doing it in other location? So we looked for options. It should be in European Union. So we looked for options, and the best legislation we found in Cyprus.
Mm-hmm.
We are in the Republic of Cyprus, which is European Union, so we are not in the occupied area of Cyprus. And the legislation there is amazing.
Yes.
It offers now the opportunity of treatment up to the age of 53. Single women got free, I mean, not free, but I mean, problem-free access to fertility treatment. PGTA is allowed. You don't need to write special applications by Ministry of Health. Like if you put indication, it is allowed. Egg donors, sperm donors can be open, can be anonymous, which is great opportunity because in most countries it's either this or
Yes.
this. In Spain you have anonymous, in the UK or Sweden you have open and no option. Here the patient can decide what is best for her. So we ended up in Cyprus. At the moment we are setting up our own clinic, but since April 2023 we are working in collaboration with existing clinic in Limassol, and we already treated several hundreds of our international patients there. Amazing thing happened 2 weeks ago. Two of my Russian doctors got their medical licenses confirmed for medical reproductive
Brilliant.
tourism in Cyprus. So we got the first 10 results of embryo transfers, and 7 out of 10 are positive, and it's amazing.
That's
And we are very, very, very
that's
happy. Yeah,
brilliant.
so
Congratulations.
thank you very much. So we are more than happy to accommodate difficult patients, patients with long history of unsuccessful attempts, patients with different comorbidities like, I don't know, autoimmune diseases, hormonal diseases. We have lots of cancer survivors in our patient pool as well. So we know how to work with patients with very complex combination of factors, and we have a professional team to help them both in St. Petersburg and in Limassol.
And working with same-sex couples and also solo parents by choice, I presume, as well.
Single mothers by choice, yes, possible in Cyprus, and that's what I mean is a great achievement in this country. Since December last year, they got problem-free access till the age of 53. Single mothers by choice, they don't need to write any applications by the ministry anymore. They get it just like a regular patient. With same-sex couples, sadly, the community in Cyprus is still quite conservative.
Okay.
So if it is a female same-sex couple and they are not officially married, then of course she can be registered for treatment as single. But if they are officially married, this is what is, I think that's basically the only issue with Cyprus legislation today.
Okay.
But this would be no difficulties to help such couples in Russia if they would like to travel.
That's really good to know. So let's talk about the IVF money back guarantee program that you offer through Olga Fertility Clinic. I'd like to start by asking you what this program is and how does it work?
The contract is very straight and very simple to understand, and it covers interests of the patient hugely. We do the money back guarantee contracts through American legislation. We chose this geographic zone for banking and legal contracting because they have huge experience in shared risk programs, and it gives our patients opportunity of problem-free refund should this situation arise. Also, refunds are possible in different points of the contract. What I mean, of course, it is 100% refund if all attempts included in your package are completed and there is still no baby born. But life situations sometimes change, relationship change, health situation change. So inside the contract, there are exit opportunities with partial refund.
Okay, that makes sense. And so how does it work in terms of when someone speaks to you about it? What's the criteria, and who is it useful for, and what would be included in the package?
So there are several questions in one. For every patient who would come to us, the process is very straightforward and very convenient. first we request all the journals from previous treatments and all the previous test results to fill in our questionnaire, which asks also about general health and other important aspects, and to do ultrasound examination. We ask to do it between day 7 and 14 so that we can see how the lining looks and ovarian reserve at the same time. For patients who consider IVF with their own eggs, it's under the age of 44, we ask for AMH test. Both ultrasound and AMH test should be not older than 6 months. And this all will be uploaded in our protected data storage. And then consultant will be attributed who is going to look into this. So on average, because we get such tough cases, it may be like 50 pages of data, we spend 6 hours on average to study one case. So one experienced consultant will sit with this and calculate the number of potential attempts which are necessary to achieve successful live birth using own eggs. If we are talking about patient under 44, after 44, we are offering only donor eggs for the same reason. So if the number of egg retrievals is visible with the light ahead of the tunnel to achieve successful live birth with own eggs, then own egg IVF with money back guarantee of live birth will be offered, and we have 3 package and 4 package, which means, okay, if I can see a patient, let's say in the age of 40 with AMH so-and-so, with previous number of attempts so-and-so, and blastocyst formation like this, then I can offer her 4 IVF package with using their own eggs and money back guarantee. There may be patients who have significantly reduced ovarian reserve or significantly increased reproductive age. In this case, either for a 3 IVF package with donor eggs may be offered, or we have combination 2 own egg IVF plus 2 donor egg IVF. Usually, exclusion criteria for own egg IVF is that the number of potential egg retrievals becomes unrealistic to achieve 2 blastocysts with normal chromosomal count. In case of donor egg IVF, I can hardly think of exclusion criteria, which would be severe autoimmune disease, uncompensated, and proof of multiple miscarriages with chromosomally normal embryos, so that we know that we are not ruling the situation, that even if it is going to be super embryo, the body is not compensated, and if we see no way to compensate. Life-threatening diseases like cancer or uncompensated diabetes or some other diseases in which pregnancy would be a threat for maternal health and life and the baby, and psychiatric conditions that patient cannot be psychologically stable. So basically only that. Yeah, so that's about inclusion criteria. So they're very broad.
So the starting point would be that people would come to you and they would have a consultation, and then medically that would be looked at by doctors for, like you said, in depth for say 6 hours, and then would you then come back to the patient with a recommendation of, based on your personal circumstances and your medical history, we would recommend that this package could suit you?
Absolutely. This, I have to underline that this is done on distance. Because we have been situated in Russia for 20 years, we know that it has always been a bit more difficult to travel to Russia than in the rest of Europe. So this consultancy is done on distance, and we are so experienced in this because we are dealing with medical reproductive tourism for 20 years. And it's not going to be just recommendation of the package. Usually after these 6 hours of study, the expert doctor is writing several pages analyzing what was done, what we have, and what would be solutions, and what would be strategically, tactically, and what fits into which package. And they discuss it on a Zoom meeting with all the explanation. Usually it is 2 Zoom meeting, one to explain everything, send the written explanation, And then 1, 2 weeks after, one more talk, because when patients read our explanation and recommendation, they of course will have extra questions. And then the doctor will answer all these questions in the second meeting. And basically, after this, the patient can decide, okay, so I decide for this suggestion, or I decide for this suggestion, or I take a break to collect funds, or I take a break because I am doing my last attempt in Sweden.
Mm-hmm.
So we don't decline patients if they want second opinion. And I think that's great if they are thinking about plan B while doing plan A. So it may be different circumstances, and these consultations are non-obliging. We know that our patients will come to us, and then they will pay. They will pay when they receive their first
Mm-hmm.
treatment plan. But the whole strategy and package discussion, donor choosing if it is necessary, discussing issues with our former patients, we offer this opportunity. So this all is free, because this
Amazing.
gives us opportunity to have dedicated, compliant pool of patients with whom we really want to sit in one boat and share responsibility. So that's basically non-obliging, not
This is
binding,
something
and open for everyone.
that we get questions about a lot, and so for anyone who is interested in learning more, as Dr. Olga says, there's no obligation and there's no fee to begin this process. So if you want to find out a bit more and you feel like this could be an opportunity that you've been looking for, then please do head to our link in our bio to contact the team, who would be very happy to assist you with personal plan and recommendations to find out more and get started. I would love to know a little bit more about the patients that you see. Do you find that you often have patients coming to you who have had failed cycles elsewhere or unsuccessful cycles elsewhere, and they want a new protocol and they want to give it their all to get the best chance possible?
We have quite a lot of patients like this. And as I said, if let's say in 2010 they were coming mostly for egg donation, being in their late 40s, and there was nothing else to offer in late 40s, only egg donation. So now the average age of our patient is around 39,
Okay.
40, and there it can be own egg and can be donor egg. And
Yeah.
here sometimes the urge is so fine, so difficult to define, that you really need these 6 hours to be able to offer patient less invasive solution if it is realistic.
Mm-hmm.
And yes, we have patients who have been 11 times eggs out, 22 times
Wow.
embryos in.
Wow.
And yes, they have one, even two children with their own eggs. On our website, we have on olgafertilityclinic.com, we have a part called Success Stories. And there are different success stories about all the different journeys. And we calculated an average 4 attempts in the
Yeah.
past before they come to us, but can be 0, can be 29. So it depends on the case.
I know that you've also had a lot of excellent PR. There's been articles where you've featured with helping couples or people succeeding with an IVF baby after very, very long journeys. So if people want to read more, please do head to our link in bio, as it's really, really fascinating and promising and inspiring to hear about how you've been helping people and how you continue to help people with these advances in treatment, but also in the opportunities that you're offering with things like the IVF money back guarantee. I know that when I was a fertility patient, one of the most difficult things about being a fertility patient or going through IVF is the not knowing. And there are so many things in your life that you can control, and this is not one of them, as a patient. And so the pressure that you feel going into a cycle of IVF, knowing that this might be your only opportunity or your only cycle, and if this doesn't work, you will have to potentially start from scratch, pay again, is very, very nerve-wracking, and it makes you very anxious. And so to be able to have an opportunity like an IVF money back guarantee means that you can go into a treatment cycle feeling a little more relaxed, knowing that there is an opportunity to try again should this first sort of cycle or attempt not be successful. I'd love to know from those who are listening or watching today who is currently doing an IVF money back guarantee, or those who are thinking about it, because Dr. Olga is here to join your questions. And it is fascinating to hear who it's helping, and why and how, and the advancements here. So please do feel free to ask live. We did have a question which ties in with what I was going to ask you next, which was earlier on as you were joining. Someone had asked, what are the chances of a baby with IVF? Oh, sorry. Well, I'll ask you this if that's okay, and then I'll ask you the next one. What are the chances of a baby with IVF with endometriosis, for example, and how would a condition like that affect having a money back guarantee program?
Of course, endometriosis, if it is external genital endometriosis, which means the lesions are placed in ovaries or in peritoneum, if it is extended endometriosis, the egg quality may decline. Um, there are quite persuasive studies from quite long ago when you remember there was this egg sharing when IVF patients in different countries where egg donation was allowed, but there were no donors, were allowed to give away some of their eggs, and the recipient would cover part of full cost of their cycle. So there were quite a lot of these reciprocal studies when eggs from a patient with endometriosis was given to recipient without endometriosis or vice versa. And the chances were lower in those who got eggs with endometriosis. That means in the worst case scenario, if it is huge endometriosis, declined ovarian reserve, and advanced reproductive age, egg donation is still very, very helpful if it is external genital endometriosis. If it is endometriosis in the uterus, which is called adenomyosis, depending on how extended it is, but I mean, we have patients with uterus as big as watermelon, and we still managed it. Of course, they have extremely high risk of miscarriage, but I mean, we managed lots of patients like this. Talking about own egg IVF by endometriosis, we have a lot of patients who are successful with this. If the age is under 42, if there are several blastocysts per cycle so that we can find chromosomally normal cycles, it's very realistic. We just should keep in mind that they may need maybe a couple of more embryo transfers, that implantation rates may be a bit decreased, not because of environment in the uterus, but because these eggs are less viable, again, by this external genital endometriosis. Yeah, we have a lot of experience with this.
Okay. Someone has just said that they're a current IVF patient of yours, of Olga in Cyprus. They've had 4 previous egg collections, and your team are amazing. Your team is in contact almost daily since April, and their transfer is in September. So it's always amazing to hear these stories of people who are living it firsthand, and thank you for sharing.
Thank you for sharing. And I presume the 4 egg retrievals were before she came to us. So I
Maybe.
think that
Yes.
not the 4 egg retrievals, there will be too many.
Yeah. Oh, yes. Exactly. But I think that she's saying that now she's found your team, she's very happy with the care that she's receiving, and the transfer is happening in September. So, brilliant. In terms of who you touched on it, but who would benefit most from the IVF money back guarantee program?
I think everyone would have peace of mind. It's just that motivation is by patients who have been through fertility treatment for some time and who have already spent that amount of money or comparable amount of money and not got a baby and didn't get money back. So that's my usual patient group, which I used to have since 2006 when starting back in St. Petersburg after Germany. So that's because of them in 2016 I introduced money back guarantee, because at some point I felt that my personal energy resources and energy resources of my experienced team are not enough to persuade patient that it may work. So basically this gives hope that if a company, a team, the clinic or the group of clinics practices money back approach for 8 years already, and they did not go nuts and were not lost in the ocean of bankruptcy after pandemic and after what happened with 2022 and all the international patient flow, etc., then they probably should be good. And maybe I should sit down and lay back in the I'm usually saying in the first class wagon of a train, which brings you to your final destination, a baby. And if the train does not bring you to the final destination, then the company returns you the money for the ticket, so to say.
Mm-hmm.
And many patients feel like, oh, finally,
Mm-hmm.
because micromanaging the process that you are not able to control. You cannot control the lab. You cannot
No.
control the even how precise the ultrasound sonography is. You can't control. So the same as, for example, I control legal services in Cyprus. So I mean, I would love to have money back guarantee for a baby like a clinic. That if there is a new clinic, Olga Clinic, then that is fine. If not, then it's 100% money back. But such services exist seldom
Yeah,
for result
absolutely.
of money back. Yeah, so it gives lots of peace of mind for patients and motivation. Patients who have not succeeded before,
Mm-hmm.
that they know that embryo transfer is not a baby, positive HCG is not a baby either, positive heartbeat is not a baby either.
Mm.
So then they want this dearly, and they don't want their money back. Of course,
Mm-hmm.
they want the result.
Of course. The patient who has just messaged, yes, her previous retrievals were in England and in Belgium, so she came to you following that. Someone else has also said they have endometriosis, and how do you say it? Adenomyosis. And
Adenomyosis.
thanks to Dr. Olga and the team, she's now a mother of two, so it's always amazing to hear for the success stories
That's
as
nice.
well.
Thank
So
you. Thank you
please
so
do head
much.
to our link in bio and check them out. Success rates. How do they compare for IVF fit treatments typically versus those who opt in for the money back guarantee program to those who don't?
And many team members who are dealing with the process, like embryologists or treating doctors, they don't even think which package patients are. And they don't even care, and they don't even want to know, because SOPs are the same. So we have to achieve successful
Mm-hmm.
pregnancy and live birth within minimal number of attempts. So every embryo matters. Every biopsy embryo matters. Every result matters. Um, so that doesn't matter.
Yeah, that's very good to know. If anyone else has any questions around success rates, please do feel free to ask. And what should be included in a really comprehensive IVF money back guarantee program to ensure that patients are fully protected and supported? And I know we've just had lots of people talking about the support that they felt through Olga Fertility Clinic, so I'd love to hear a bit more about that.
From the very beginning, each patient, doesn't matter for which package she will decide or will be offered and decide, every patient gets a personal coordinator. We have 10 coordinators working online with all the initial requests which come to our mailbox, or patients who are calling. And it's not like a call
Mm-hmm.
center, so you are having a personal coordinator, and this person is going to walk you through the whole explanation process until you are handed to the treating doctor and his or her team. So that gives a lot of support already, because you don't have to tell your story twice. So you have a person who guides you through all the mails step by step. This coordinator at certain time will help you to collect your paperwork, upload it for the expert doctor, and the doctor will have a look at this. And at the same time, while you are waiting for the personal consultation and the doctor to finalize the analytics, you can have a free of charge consultation with perinatal psychologist. We have two in the team, brilliant ladies who have a specialization as perinatal psychology, which means helping women on their journeys to maternity, also during tough pregnancies, also during losses, or even complicated first year. So the focus is maternity. We offer also patients to speak to our former patients, because
Oh, that's
sometimes
good.
talk to someone in the same situation can be even better than many sessions with psychologists. So
Mm-hmm.
if we can match the talk so that this former patient is speaking to a future patient, and their medical or psychological or life situation is in some way similar, this can make a great change. So I remember when I was doing these matches personally, because I had a huge pool of patients before I started my own clinic. these friendships are still lasting. I'm
Mm.
meeting my former patients in family gatherings, which we arrange every year in Stockholm, Copenhagen, and other places. And sometimes, like two families are coming and say, "Do you remember you arranged this one-to-one talk with former patients? So we are friends now 10 years."
Oh,
And
that's
one
so
has
nice to hear.
children, who are teenagers, and others has a bit younger children. So this one brought this one. They never met before, but now they're friends. So the support is huge also, which patients to patients give when they are during treatment. So we arrange different events in St. Petersburg and Cyprus for our patients who are coming for treatment. And here also many friendships started. And I think that's the huge value, that we create safe environment for
Hmm.
people from different countries to open up and to share with each other, because no one else can understand better than person in the same situation. So I think that's the huge thing. And of course, I mean, we have amazing nurses who accompany the process also online for our patients. Every patient, as soon as the package is chosen, strategies is finalized with expert doctor, gets personal treating doctor who is going to see in the clinic, watch everything online with all the sonography test results, etc., answer questions online, do egg retrieval, embryo transfer, report results, discuss next steps. And treating doctor has administrator who is doing the emails and the nurse who is in the backup for all the questions. So it's care all the time, and the patient is never left alone. So there are several supportive hands.
Fantastic. That's amazing to hear. And also, I guess if people are considering the IVF money back guarantee programs, they can speak to other people who may have done it before, to find out a bit more about what's involved and their opinion on it.
That is true, and not only to those who have successfully completed money back guarantee package with a
Mhm.
baby, which are now 700 people, but also those who got their money back. Because I think this is very important part of it,
Yes.
that people know that people are
Hmm.
getting money back, and that's one of research which was done by journalists, by us. So we had a patient in Australia who got quite a lot of attempts with donor eggs as well in the United States, and she got a baby on the first attempt with us, on the first embryo transfer with us. But I mean, we gave her some treatment before, and she went on television, and it was like great result. But then we were approached by journalists who said, "But can you confirm that you're really giving money back?" So I had to call patients who got money back and ask them, "Can you speak to the journalist?" And then they published a big article, which is still available on our website in the part Media and Press. So from Johnny Walker, it's a very famous in Australia. So I think I said the name right. I can look it up. I can look it up and tell you the name and tell you the page. So it was great. It was great that people interviewed and gave him information, and then
Yeah,
he
of
published that he
course.
made.
Yeah.
Yeah, it's
You want
very
to
good.
you want to know that what you're signing up for is what you're hoping it's going to be. So do head to our link in bio. You can read all about these stories there as well.
Yeah.
And you've mentioned it a little bit, but anything more you want to add about what's included in these really comprehensive IVF money back guarantee programs? Um,
Yes,
yes.
yes. So every package. So first of all, patients who come to us, they don't have only embryonic factor why they are not pregnant. There are a lot of maternal factors, and usually they have several reasons why they're not pregnant yet, especially if they come after multiple egg donations. In each package, hysteroscopy with in-depth checking of endometrium is
Okay.
included. Should
Okay.
it be necessary, patients don't have to pay for it. And we check endometrium very thoroughly with immunohistochemistry, histology, microbiome, inflammation, everything. And of course, we visualize the whole uterine cavity and also correct what we find. Then there are several types of packages for couples. It would be 3 IVF package with money back guarantee of live birth. PGTA is also included. Patients who come to us are usually upper reproductive age, so the percentage of chromosomally abnormal embryos is pretty high. So PGTAs is also included. And
Okay.
similar is 4 IVF package. So the difference who would get 3 IVF package with own egg or 4 depends on the number of IVF attempts that we need to be able to share risk. To be able to share risk, we usually need 2 or more chromosomally normal embryos, because chance of live birth with 1 chromosomally normal embryos with us is 52%. So we want to be like by 75% or something of chance of live birth if we have 2 chromosomally normal embryos, which we would transfer one by one, not in one transfer, or more. Then there are types of patients where egg donation is the only solution. So this would be patients 45 and older, up to the age of 53. And there it would be then 3 IVF with donor eggs. Also, if necessary, hysteroscopy with induction of an endometrium is included. And there are types of patients where we know what can be optimized in their IVF cycle using their own eggs, but the statistics is not on our side of the field, so to say, playing. For example, we know that we can get more blastocysts, but the woman is 43. So, I mean, when 43, we need 8 blastocysts to find 1 chromosomally normal. So it becomes a bit difficult to predict, but patients hear what we are saying, that yes, we know how to improve number of blastocysts, we know how to improve your receptivity, and that's what was not done before. So we are ready to share risk with you, trying 2 times with your own eggs IVF. And if it doesn't work, so if we don't get into lucky embryo, which is not controllable in that case, then we go for 2 times IVF with donor eggs. So we call this combined package. For single mothers, we have so-called double donation, which or embryo donation, which means they can also choose an egg donor from our egg donor database and choose a sperm donor. But we offer this as small IVF cycles with guarantee of 1 blastocyst each, and it will be then 4 embryo transfers or a baby or a money back.
Yeah. You mentioned microbiome testing, and I think that's really interesting because it shows your holistic approach to making sure that every stone is unturned, to really give a thorough investigation before any treatment starts.
Yes, yeah, and we have much more than that. I'm not going to take much time on this, since we have women with quite a long story, also with general health issues. It is a bit more difficult to arrange in Cyprus, but in St. Petersburg, for example, we organize for women in their late 40s, early 50s, the whole general health check for just 1,900 euro. They are checked from here till here and back, seeing 5 different specialists, checking heart, liver, kidneys,
Wow.
checking their gastrointestinal system, immunology, hormonal, because we also offer money back guarantee in late 40s.
Yeah.
So we became so experienced in providing healthy opportunity for becoming pregnant, having a baby in really advanced reproductive age, that now when the age limit was increased to 53, we can still keep it safe.
Fantastic.
So yeah, so microbiome is just one of
And
this.
in terms of live birth rates, what would you say these are from the packages?
So I think it is going to be more clear if I say per embryo transfer.
Yes, that is clear, yeah.
Because that's what a patient needs to understand, how many times she needs to put embryo in and survive if it's negative outcome, because that's what makes people so sad, negative embryo transfer.
Of course.
So how many times she needs to put embryo in to have a fair chance of live birth. So from year to year, with IVF PGTA own egg, transfer of single embryo, chromosomally normal, 52% chance of live birth, which means 100 embryo transfers, 52 of them gave birth. But then the other 48 know that they do again, and then 24 out of them will give birth. So that's why I'm saying that to share risk on IVF with own eggs, we want to calculate the number of egg retrievals to be able to have at least 2 chromosomal normal blastocysts, then we can share risk.
Mm-hmm.
And with egg donation, it is 49-50% live birth rate per 1 embryo transfer
Okay.
of single blastocyst.
Mm-hmm.
And basically then each patient can calculate that 2-3 embryo transfers and I'm done on average. Yeah, but because we have such difficult patients, some patients are getting pregnant on the first attempt, but some may need third or even fourth embryo
Yeah.
transfer.
Yeah, absolutely. And someone else has just said that they have also been to your clinic and received the 3 IVF package, and they were fortunate enough to have a baby on the first try. They've previously tried for 7 years before when they weren't getting pregnant. So that's amazing
Thank
story
you
to
very,
hear.
very much. And they are all documented on our olgafertilityclinic.com success stories. And I am very happy to see that now in 2020s, people are much more open about their fertility journeys than it was 10-15 years ago. So there you can find their
Yeah.
personal Instagram addresses and you can connect to them. The same also you can see on my Instagram, and you can write direct messages to people if you feel like you identify your situation with their successful story. Get hope from this, get motivation from this, contact them. And if they could do it, you can do it.
Brilliant. And the same lady has just said multiple miscarriages and believes as well in the holistic approach and the tailored treatment that she's received from you for the embryos where PGTA was done, which goes with what you were just saying about those full checks that you do and how it's so thorough, which is so key not to miss anything, and obviously why you have such amazing success rates with what you do. So if anyone has any other
Okay.
questions as we're going through, please feel free to ask. I wanted to also ask you, you've talked a little bit about eligibility criteria, and some people might think, oh, well, I wouldn't be eligible to be able to do that. What would your advice be to those people? Would you say get in touch anyway and just ask those questions and have a conversation about it?
Yes, I think so. Because as I say, I can hardly think for about exclusion criteria for egg donation package would be psychiatric or general health comorbidities which are not repairable.
Hmm.
Um, and yes, absolutely, to contact us at info@olgafertilityclinic.com
Great.
and to ask, I want to get a second opinion consultation with one of your leading doctors. What shall I do? And then you will be guided further. You don't even need to do anything else. You will be told what information to collect, when to connect on Zoom, which conclusions to read, and then you decide what to do with them. Absolutely.
Fantastic. Great. And then I want to, you've talked a little bit about attempts, and I think that's something that people often ask us as well, and you probably see it when people first come to you. How long do you think it might take? And I know that this is based on AMH, age, egg quality, medical history. How you've talked a bit about how you sort of would analyze this history to give people an estimate of how long it might take them. Um, is there any more you want to talk about around that or tell people today?
If it is egg donation, then it can be just one trip and that's it. But if it is IVF with own eggs, one of the challenges is to have chromosomal normal embryos in our patient pool, which are either older and percentage of chromosomal normal embryos is low according to the age, or they are younger but with significantly reduced ovarian reserve, or they are having both. Finding chromosomally normal embryos could be a challenge for IVF own egg
Mm-hmm.
group.
Mm-hmm.
So typical IVF story in usual IVF patient would be 1 egg retrieval, 3 embryo transfers if they are not chromosomally checked. So our case would be 3 egg retrievals, 1 embryo transfer, because we check all embryos, they are as good as gold, and we need sometimes 1, 2, 3 times eggs out to create embryo. So duration of treatment for IVF with own egg can be until pregnancy is achieved around 1 year. So if you need maybe to pick up eggs several times,
Yeah.
For egg donation, it can be just, okay, you decide today to come to us, you come to us in September, and you don't need to come to us anymore.
Mhm.
So that may be the most frequent scenario for egg donation.
And for people who are thinking about having treatment abroad with yourselves, and they're, might be concerned about the time they might need to take off work or what it's like having treatment internationally, what would your advice be?
We are very experienced with distant treatment, and most of the steps are done on distance. We have also lots of dialogue and collaboration with local doctors who we say what we need. Basically, if you are doing egg donation and you are using husband's sperm or partner's sperm, then you come to us for a week, deliver sperm, we fertilize the eggs. 6 days later, we do your embryo
Hmm.
transfer. Hopefully, you come back in
Hmm.
2 years for a sibling. If it is the old egg IVF, then it can be more visits. But again, we make all the pre-treatment while you're in local country with all the supplements which you need to start taking 3 months before egg retrieval to boost your little immature eggs. We want you to come for 1 week so that we have opportunity to screen you once or twice before we decide the egg retrieval day.
Yeah.
And then maybe 2 months later, you have to come again for next egg retrieval if chromosomally embryos were not found. If chromosomally normal embryos were found, then we may ask you to come for hysteroscopy to check your lining if we see that it's not only embryonic factor, which could have been the reason why you're not pregnant yet. So we will check your endometrium and some other parameters. For all these practical things on our website, we have IVF process, the chapter which describes on olgafertilityclinic.com IVF process, which describes every step of our individualized IVF. And at the very end, it's a very long page. At the very end, you see cumulative pregnancy rates, and you have also some possible scenario like month 1, month 2, month 3. So what is the shortest possible scenario? How many months it takes? And what is the longest possible scenario? So for IVF with own eggs, the longest possible scenario would be a year
Hmm.
before you're ongoing
Hmm.
pregnant if you are the most challenging patient. And the shortest possible scenario would be 3 months. Egg pickup, and then checking, chromosomally normal embryo found, 1 month break, next month embryo transfer.
Okay, good to know. Please head to our link in bio to find out more. The team are very happy to talk to you and give you a consult to talk through what this might look like for you in your journey, in your medical history, etc. And then in terms of managing any risks associated with offering an 100% money back guarantee, tell us a bit more about that and what you do your end.
So first, in 2016, we offered 80% money back guarantee, and
Okay.
that's how we worked until 2020. In 2020, we analyzed our success rates, and we saw that the pandemic didn't kill us, and everything is fine with results and the team. So we offered 100% money back guarantee, and that's where we stay in both locations.
And have you found there's been an increase in people wanting to do it since you've been able to offer that 100% money back guarantee?
We didn't feel this because the circumstances were working against us. The war started in
Mm-hmm.
2022, and people have crossed out from the list until we found Cyprus. Now we have patients coming in both locations, but we still haven't reached the number of patients that we had in 2019.
Cyprus is a popular destination, isn't it? I know
Yes.
because we get lots of people asking us for options and where to go for clinics abroad, and Cyprus obviously is a destination that people might might look into for a holiday destination as it is. So being able to combine that with treatment can be attractive to people. I had IVF abroad, and I liked the fact that I was able to take time away from work and focus on myself, my husband, getting treatment, not feeling rushed going into the clinic. Not feeling rushed with the pressures of work whilst having the treatment and the procedures and being able to take a little bit of time to step back,
Yeah. Yeah,
emotionally
absolutely.
and physically.
Absolutely. And also important that we are in the Republic of Cyprus, which is still left side driving. Everyone is speaking English because it is from a colony of Great Britain. A lot of flights from the UK. And important is that we are not in the occupied northern part of Cyprus, where there is no legislation for artificial reproductive techniques, where the level of clinics is not controlled by whatever state, because there is basically no state. Where 2, 3, even 4 embryos may be transferred with a huge risk of having multiple pregnancy, also for women of advanced reproductive age. So I think the location where we can offer treatment now in the Republic of Cyprus is both well controlled and safe, and at the same time giving excellent opportunities which are legally fixed, that their parliament have voted for wonderful opportunities for reproductive techniques.
It is a fantastic opportunity that people should explore. So please do head to our link in bio to find out more. You mentioned a bit patients and part of these programs since 2016. Anything else that you want to add around what you've seen change over the years, or the advances of treatment, I guess, getting people to where they are today, and success rates with that as well?
I think that the patients we are getting became more difficult and more difficult because of the reputation we are having. That, okay, so if it doesn't work, I go to Olga Clinic. So that's what we see, but we still maintain our success rates years long, despite patient population becoming tougher.
And when people are thinking about options abroad, what would you say sets Olga Fertility Clinic apart from other clinics that people might be looking at?
Individualized treatment. We have enough of experienced doctors who have 6 hours to analyze your case. Individualized team. You don't need to tell your story twice. Personal coordinator, administrator who micromanage your process, and you don't need to focus on all this. Of course, money back guarantee with very comprehensive rules. So everyone who wants to read the deal points, just write to us info@olgafertilityclinic.com and have a look at the deal points, because it is so easy to understand. And yeah, so you see all the if immediately.
Yeah.
And of course, for those who consider egg donation, we didn't speak much about this, but I think that's unique. The database that we are having since 2013, that was again when I followed the needs of the patient. I was doing a lot of egg donation in 2010, 2009, etc. And it was non-individualized profile. So we had a lot of donors, but we were choosing donors for our patients, telling them height, weight, color of eyes, color of hair, and education, occupation, job. And every second patient would be asking me, but how does she look? But how does she smile? But what is she doing? What are her interests? But do you know which books she likes? And what does her child like? So I started thinking, oh my God, I mean, we have to make it possible. So we started looking into legislation, and we found that Russian legislation allowed this, to be able to present a lot of data about egg donors, which we did in 2013 with our egg donor database. It is eggdonorideas.com. And that's what the profile of the donor, which is difficult to find somewhere else. So it is North European profile. So with a lot of recessive traits like blue eyes, blonde hair, fair skin, and extended profile with adult and childhood photos and 150 details about each egg donor. So I think that's another unique thing about us.
Absolutely. All really, really good points. And do you see a difference in the number of people who are having the money back guarantee programs, IVF money back guarantee programs, with their own eggs versus with egg donation?
As I said, during years, the percentage of own egg IVF grew in our patient group. So now it's like half and half.
Okay.
While the project itself, as international IVF project, it was started as egg donation. So in 2005, 2006.
If people want to start with their own eggs and then they might move on to donor eggs, that's okay as well.
Absolutely. The only thing that we will be strongly against doing own-egg IVF after the age of
Hmm.
44, because our huge experience, all the literature says that after 44, you can hardly find chromosomally normal embryos.
Yeah, that
Um,
makes sense.
so, before 44, of course, so we analyze all the data and
Hmm.
suggest what is realistic and what can be achieved.
Fantastic. I really hope that this is giving everyone hope and reassurance watching this today. It's an amazing program. Please do head to our link in bio to find out more. And as Olga said, she has a fantastic Instagram account. So please do DM to you directly as well, or we can help with any questions or put you in touch. We get a lot of our readers and followers asking us about options abroad for treatment and also around IVF money back guarantee programs. So if you want to find out any more, please feel free to get in touch. We're always happy to have a chat, as are your team, of course. And I just wanted to say also, we've had a lot of questions about medical questions about treatment plans, personalized treatment plans. So I would say please feel free to get in touch with the team who can arrange to speak with you personally to discuss your medical history and treatment going forward. So do reach out. Anything else that you would like to add, Dr. Olga?
I would like to say that going through fertility treatment is tough. Luckily, I haven't been through this, but some of my friends and relatives were, and I'm a very empathic person. Sometimes I'm crying looking at what is happening with women after multiple and successful attempts. So everything in my system, which I spent 20 years building, is aimed as maintaining self-care, self-love, self-esteem during this process. And this is not only just psychologist or holding you during the process, it's the whole system. Achieving your baby within minimal number of embryo transfers. Because egg retrieval is egg retrieval. It's like
Yeah.
operation. If you're not doing embryo transfer in this fresh cycle, you're not sharing responsibility with this embryo. So you're
Mhm.
just like egg donor. You collected eggs for yourself and you continue with your life and you wait for the check of the embryos to be back with PGT result. So what is crucial is the embryo transfer. It is super valuable embryo in super valuable environment, not only of your uterus, but also of your soul. And I think that in our system, this achieving success within minimum number of embryo transfer, this all is about saving this love for the future baby, for the future family, so that when you're ongoing pregnant, you still have lots of energy and lots of love to continue with your life. So that's why we are there.
Fantastic.
And this should be as quick, as efficient. And that's why we say we better sit 6 hours and analyze how we do it. And then we do it. And if it didn't work, we do it again. And
Mhm.
then it works. So as soon as possible.
One thing actually, someone asked earlier, they were talking about things that couples who are dealing with unknown male infertility have to think about. So, sperm motility issues, for example. We've talked a little bit about egg donation. Do you have people coming to see you who need help on the male side as well with sperm donation?
Sperm donation would be a solution if there are no live sperm cells available at all. So we have huge experience with working with male cancer survivors as well,
Mhm.
with single sperm cells available in ejaculate, with having to deal with several ejaculates to find these single cells.
Yeah.
So as I said, so we would go several extra miles to make it possible to achieve success using own egg and own sperm. Of course, if it's not possible or didn't work out, then of course sperm donation is one of the options, but we can do also a lot on improving sperm situation. Of course, we are not going to take ages because the woman's age is crucial, but if the woman is taking her supplements 3 months to improve your egg quality, then we can spend 3 months on the man as well. And if necessary, we can back it up with donor sperm, which can be chosen from one of European sperm banks. But we would never insist on this if there are at least some sperm cells available.
Okay, that's good to know. My husband is infertile. We use donor sperm for our IVF cycles in children, so it's always interesting to talk about third-party reproduction options as well, and how life-changing someone who donates is. You
Yes.
know, altruistic people who do amazing things to help people complete their, well, have a family is incredible. So again, if anyone wants to discuss sort of sperm egg donation, the door is always open for that. Thank you so much, Dr. Olga, for your time today. Is there anything else you'd like to speak about or leave us with today for everyone who's been joining and watching this back?
I want to thank you from the bottom of my heart for giving opportunity to your listeners to find out more about opportunities which exist. And to everyone who is listening today, I want to say that fertility treatment makes very strange impact on self-confidence. And a lot of patients who came to me, they thought their situation was worse than in fact
Oh,
it
wow.
was. So I think it is very normal that if you're going through a roller coaster like this, and if your self-esteem and self-love declines with every unsuccessful transfer, that you start seeing your prognosis and your future not in very bright colors. And I strongly recommend you use our experience to look at your situation from a helicopter without the pain that you are feeling, or at least with less pain than you are feeling, and to give you written conclusions and recommendations. And we don't mind if you walk away with them and come back in a couple of years if you still need this. We don't mind if you disappear, because we know so many of you will come to us for treatment, so we do it free of charge. You pay only when you start with the treatment with your first treatment plan. So that's what I would recommend you. Write us an email to info@olgafertilityclinic.com and ask for second opinion consultation. We will advise you what we need, and you will get an in-depth look in your situation from someone who is experienced and not biased. Because you are biased, you as a patient, you are biased because you feel so much pain and you suffer so much from the situation that you may not see the light ahead of the tunnel, which definitely exists.
I think you've summarized it nicely, that you've got nothing to lose getting in touch and discussing options, and it might be exactly what you're looking for. So thank you to you as well and the team for giving all of our followers and listeners this fantastic opportunity. So yeah, please do reach out to the team. The link's in the bio. And thank you so much for joining me today. It's been an
Thank you.
absolute pleasure speaking to you. I've always wanted to do a live with you, and I'm honored to have you here today. So thank you, and thank you to those who have been listening and watching. I'm sure you found it as interesting and helpful as I have.
Thank you very much. And I wish good luck and successful embryo transfers to everyone who is listening. And thank you one more time for having me today.
Brilliant.
Bye.
Thanks, everyone. Have a nice evening. Bye-bye. Bye.
Bye-bye.